In this nervous system part 5 video, we will cover peripheral nervous system. The nervous system is mainly divided into two parts, central nervous system and peripheral nervous system. We have covered already central nervous system in previous videos. Peripheral nervous system is divided into two, sensory division and motor division. The sensory division is afferent division which carries signals from nerve endings to CNS. The motor or efferent division which carries signals from CNS to rest of the body. The sensory again divided into somatic and visceral sensory. Somatic division carries signals from skin, bone, joints and muscles. The visceral sensory division carries signals from viscera of heart, lungs, stomach and bladder. Somatic is a general term referring to parts of the body like the bones, skin and musculoskeletal system. Visceral is a term that is used for referring to internal organs and vascular system. The motor or efferent division which carries information from CNS to rest of the body is divided again into two, somatic motor and autonomic motor. This autonomic motor again divided into two, sympathetic division and parasympathetic division. The somatic motor allows voluntary movements of skeletal muscles, while autonomic motor provides automatic activities such as control of blood pressure and heart rate. The peripheral nervous system consists of the peripheral nerves connecting the central nervous system to other parts of the body. The nerves of the PNS are classified as either cranial nerves or spinal nerves based on the location in which they arise. Then we will see nerves. Nerves of PNS. A nerve consists of numerous neurons collected into bundles. Each bundle has several coverings of protective connective tissue. Endoneurium is a delicate tissue surrounding each individual fiber, which is continuous with the septa that pass inward from the perineurium. Perineurium is a smooth connective tissue surrounding each bundle of fibers. Epineurium is a fibrous tissue which surrounds and encloses a number of bundles of nerve fibers. Most large nerves are covered by epineurium. Endoneurium covers individual fiber. Perineurium covers bundle of fibers. Epineurium covers number of bundles of nerve fibers. Ganglia are groups of neuron cell bodies that are related to peripheral nerves. Nuclei are groups of neuron cell bodies in the CNS. The ganglia that are associated with afferent nerve fibers have cell bodies of sensory neurons. These are also known as dorsal root ganglia. The ganglia that are associated with efferent nerve fibers mostly have cell bodies of autonomic motor neurons. Afferent is always sensory. Efferent is always motor. Let us see sensory receptors. Sensory receptors are specialized endings of sensory neurons respond to different stimuli inside and outside the body. The brain can then process awareness of the stimulus, that is sensation, and interpret the meaning of the stimulus, that is perception. Two main sensory receptors are tonic and phasic receptors. The main difference between the tonic and phasic receptors is that tonic receptors slowly adapt to the situation or stimulus, whereas phasic receptors rapidly adapt to stimulus. Types of sensory receptors. Sensory receptors are classified by what stimuli they detect, their location in the body, and the complexity of their structures. So, first one is chemoreceptors. These receptors respond to chemicals in solution, including smelled or tasted molecules, changes in body chemistry, and changes in interstitial fluid chemistry. Chemoreceptive neurons are also found in the carotid bodies in the neck and aortic bodies between the primary branches of the aortic arc. Then we have mechanoreceptors. Mechanoreceptors respond to mechanical forces such as pressure, touch, stretching, and vibrations. There are three classes. They are tactile receptors, baroreceptors, and proprioceptors. Tactile receptors sense pressure, touch, and vibration. Fine touch and pressure receptors allow us to sense sources of stimulation that include exact location, shape, size, movement, and texture. Crude touch and pressure receptors only allow generalized sensations. Next is baroreceptors. Baroreceptors detect pressure changes in blood vessel walls and in areas of the urinary, reproductive, and digestive tract. Next is proprioceptors. Proprioceptors sense positions of skeletal muscles and joints and tension in the ligaments and tendons. These proprioceptor receptors originate in muscles and joints and contribute to the maintenance of a balance and posture. Proprioceptive signals are transmitted to the central nervous system where they are integrated with information from other sensory systems such as the visual system and the vestibular system to create an overall representation of body position, movement, and acceleration. The way we can tell that an arm is raised above our head when our eyes are closed is an example of proprioception. Other examples may include your ability to sense the surface you are standing upon even when you are not looking at the surface. Proprioception comes from sensory nerve endings that provide our brain with the information of the limb position. There are specialized nerves in your muscles and joints that communicate with your brain and tell it what position your joint is in and how much stretch or strain is on the muscles surrounding a joint. The nerves surround each muscle bundle, creating a system of communication with your brain about what is happening to the muscles and joints of your body. Next is nociceptors. Nociceptors respond to stimuli that may be damaging, such as extreme heat or cold, excessive pressure, and inflammatory chemicals resulting in pain. Nociceptors are common in the superficial skin, around blood vessel walls, inside joint capsules, and in the periostea of bones. Painful sensations are carried on two types of fibers called type A and type C fibers. The myelinated type A fibers carry fast pain sensations such as from a vaccination or a deep cut. The type C fibers carry slow pain, which is described as pain that feels aching and burning. Photoreceptors. Photoreceptors respond to light, for example, the receptors in the retinas of the eye. Thermoreceptors. Thermoreceptors respond to temperature changes and are free nerve endings in the dermis, liver, skeletal muscles, and hypothalamus. Although not structurally different from each other, there are 3 to 4 more cold receptors to every warm receptors. Thermoreceptors are phasic receptors that quickly adapt to stable temperature. We have mixed nerves. In the spinal cord, sensory and motor nerves are arranged in separate groups or tracts. Outside the spinal cord, when sensory and motor nerves are enclosed within the same sheath of connective tissue, they are called mixed nerves. Mixed nerves contains sensory and motor fibers and transmit impulses in both directions. Now let us see the autonomic nervous system. The autonomic nervous system controls involuntary responses to regulate physiological functions. The brain and the spinal cord of the central nervous system are connected with organs that have smooth muscles by ganglionic neurons such as the heart, bladder, other cardiac, exocrine and endocrine related organs. The most notable physiological effects from autonomic activity are pupil constriction and dilation and salivation of saliva. The autonomic nervous system is always activated but is either in the sympathetic or parasympathetic state. Depending on the situation, one state can overshadow the other, resulting in a release of different kinds of neurotransmitters. Autonomic nervous system consists of two divisions, the sympathetic division and the parasympathetic division. These two divisions have separate neural pathways and perform different functions. However, they often both innervate the same organ. Sympathetic nervous system. The sympathetic division prepares the body for physical activity. The sympathetic system is activated during a fight or flight situation in which mental stress or physical danger is encountered. Because this division prepares someone to fight or flee from danger, its effects are called the fight or flight reaction. Neurotransmitters such as norepinephrine and epinephrine are released, which increases heart rate and blood flow in the certain areas like muscles, while simultaneously decreasing activities of non-critical functions for survival like digestion. The systems are independent to each other, which allows activation of certain parts of the body while others remain rested. In contrast, the parasympathetic division has a calming effect on body functions. So, the parasympathetic system allows the body to function in a rest and digest state. The parasympathetic system allows the body to function in a rest and digest state, primarily using the neurotransmitter acetylcholine as a mediator. Consequently, when the parasympathetic system dominates the body, there are increases in salivation and activities in digestion, while heart rate and other sympathetic response decreases. Unlike the sympathetic system, humans have some voluntary controls in the parasympathetic system. The most prominent example of this control are urination and defecation. The chart contrasts some of the effects of these two systems. Sympathetic division increases alertness, heart rate. It dilates bronchial tubes to increase airflow in the lungs. It dilates blood vessels of skeletal muscles to increase blood flow. It inhibits intestinal motility. It stimulates secretion of thick salivary mucus and stimulates sweat glands. It stimulates adrenal medulla to secrete epinephrine. Has no effect on the urinary bladder or internal sphincter. It causes fight or flight response. Parasympathetic division has a calming effect, decreases heart rate. It constricts bronchial tubes to decrease airflow in lungs, has no effect on blood vessels of skeletal muscles like sympathetic division. It stimulates intestinal motility and secretion to promote digestion. It stimulates secretion of thin salivary mucus. Parasympathetic division has no effect on sweat glands and adrenal medulla like sympathetic nervous system. Parasympathetic nervous system stimulates the bladder wall to contract the internal sphincter to relax to cause urination. It causes rest and digest state. The enteric nervous system is a lesser known division of autonomic nervous system located only around the digestive tract. This system allows for local control without input from the sympathetic or parasympathetic branches. Though it can still receive and respond to signals from the rest of the body, the enteric system is responsible for various functions related to gastrointestinal system. Now we will cover cranial nerves. The brain has 12 pairs of cranial nerves to relay messages to the rest of the body, while still part of the peripheral nervous system. These nerves, unlike the spinal nerves, arise directly from the brain. Each cranial nerve is identified by a name, suggestive of its function, as well as a number, designated by a Roman numeral. The nerves are numbered 1 to 12 according to their order, beginning in the anterior portion of the brain. Some cranial nerves contain only sensory fibers. Some contain motor fibers, while others contain both sensory and motor fibers. The first cranial nerve is olfactory nerves, is a sensory. These are the nerves of sense of smell. The second one is optic nerves, also sensory. These are the nerves of the sense of sight. Third one is oculomotor, is motor. It helps for eye movements. The fourth one is trochlear, is a motor again for eye movements. Fifth one is trigeminal, it's a sensory and motor, it's a mixed. Helps for muscles of mastication, that is chewing. Teeth, eyes, skin, tongue for sensation of touch, pain and temperature. The sixth one is abducens, is again motor, helping for eye movement. The seventh one is facial, that is mixed one, sensory and motor. It helps for taste buds, facial muscles, tear and salivary glands. Eighth nerve is vestibulocochlear, is a sensory, helps for hearing and balance is in inner ear. The ninth one is glossopharyngeal, is a sensory and motor mixed. It is in pharyngeal muscles, helping for swallowing and salivation. The 10th one is vagus, sensory and motor, that is mixed, is in internal organs, helping for movement and secretions of internal organs. The 11th one is spinal accessory, that is motor. It is in neck and back muscles. And the 12th one is hypoglossal, is a motor, is in tongue muscles, helping for the movement of tongues. Now we will move on to spinal nerves. For the rest of the body, spinal nerves are responsible for somatosensory information. The spinal nerves arise from the spinal cord. Usually these arise as a web, that is plexus, of interconnected nerve roots that arrange to form single nerves. These nerves control the functions of the rest of the body. All spinal nerves carry sensory and motor messages, so they are composed of both unipolar and multipolar neuron axons. Bipolar neuron axons are only found in some cranial nerves. Each spinal nerve splits into two nerve roots as it approaches the cord, a dorsal root and a ventral root. The dorsal root has a bulge, whereas the ventral root does not. The bulge is a ganglion, group of cell bodies of the unipolar neurons. Unipolar neurons have their cell bodies pushed off to the side, so the dorsal root carries afferent or sensory messages, while the ventral root is composed of multipolar neuron axons that carry efferent or motor messages. In humans, there are 31 pairs of spinal nerves, 8 cervical, 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. These nerve roots are named according to the spinal vertebrae which they are adjacent to. In the cervical region, the spinal nerve roots come out above the corresponding vertebrae. That is, the nerve root between the skull and first cervical vertebrae is called spinal nerve C1. Between C7 and T1, the cervical nerve 8 arises. From the thoracic region to the coccygeal region, the spinal nerve roots come out below the corresponding vertebrae. In the lumbar and the sacral region, the spinal nerve roots travel within the dural sac and they travel below the level of L2 as the coda equina. Now we'll see cervical spinal nerves. Cervical spinal nerves C1 to C4. The first 4 cervical spinal nerves, C1 through C4, split and recombine to produce a variety of nerves that serve the neck and back of head that we call as cervical plexus. Spinal nerve C1 is called the suboccipital nerve, which provides motor innervation to muscles at the base of the skull. C2 and C3 form many of the nerves of the neck, providing both sensory and motor control. These include the greater occipital nerve, which provides sensation to the back of the head, the lesser occipital nerve, which provides sensation to the area behind the ears, and greater auricular nerve and the lesser auricular nerve. The phrenic nerve is a nerve essential for our survival which arises from nerve roots C3, C4 and C5 and passes downwards through the thoracic cavity in front of the root of the lung to supply the thoracic diaphragm, initiating inspiration. Disease or spinal cord injury at this level will result in death due to apnea without assisted ventilation. Brachial plexus C5 to T1. The last four cervical spine nerves C5 through C8 and the first thoracic spinal nerve T1 combine to form the brachial plexus or plexus brachialis, a tangled array of nerves splitting, combining and recombining to form the nerves that subserve the upper limb and upper back. The branches of the brachial plexus supply the skin and muscles of the upper limbs and some of the chest muscles. 5 large nerves and a number of smaller ones emerge from this plexus, each with a contribution from more than one nerve root, containing sensory, motor, and autonomic fibers. They are axillary nerve, which arises from C5 and C6. Radial nerve arises from C5, 7, 8, and T1. Muscular cutaneous nerve arises from C5, C6, and C7. Median nerve arises from C5, 7, 8, and T1. Ulnar nerve arises from C7, C8, and T1. And medial cutaneous nerve arises from C8 and T1. Next is lumbar plexus. The lumbar plexus is formed by the anterior rami of the first three and part of the fourth lumbar nerves. The plexus is situated in front of the transverse process of the lumbar vertebrae and behind the psoas muscle. The main branches and their nerve roots are iliohypogastric nerve arises from L1, ilioinguinal nerve arises from L1, genitofemoral nerve arises from L1 and L2, lateral cutaneous nerve of thigh which arises from L2 and L3, femoral nerve arises from L2, 3 and 4. Obturator nerve arises from L2, 3 and 4. Lumbosacral trunk arises from L4. Next is sacral plexus. Sacral plexus is formed by the anterior rami of the lumbosacral trunk and the first, second and third sacral nerves. The lumbosacral trunk is formed by the fifth and part of the fourth lumbar nerves. It lies in the posterior wall of the pelvic cavity. The sacral plexus divides into a number of branches supplying the muscles and the skin of the pelvic floor muscles around the hip joint and pelvic organs. In addition to these, it provides the sciatic nerve, which contains fibers from L4 and L5 and S1 to S3. The sciatic nerve is the largest nerve in the body. It is about 2 cm wide as its origin. It passes through the greater sciatic foramen into the buttock, then descends through the posterior aspect of the thigh, supplying the hamstring muscles. At the level of the middle of femur, it divides to form the tibial and the common peroneal nerves. The tibial nerve descends through the popliteal fossa to the posterior aspect of the leg where it supplies muscles and skin. The common peroneal nerve descends obliquely along the lateral aspect of the popliteal fossa. The pudendal nerve arises from S2, S3 and S4. The perineal branch supplies the external anus sphincter, the external urethral sphincter and adjacent skin. Last is coccygeal plexus. Coccygeal plexus is a very small plexus formed by part of the fourth and fifth sacral and the coccygeal nerves. The nerves from this plexus supply the skin around the coccyx and anal area. Thoracic nerves. The thoracic nerves do not intermingle to form plexus. There are 12 pairs, and the first 11 are the intercostal nerves. They pass between the ribs, supplying them the intercostal muscles and overlying skin. The 12th pair comprise the subcostal nerves. The 7th to the 12th thoracic nerves also supply the muscles and the skin of the posterior and anterior abdominal walls.